So, but the mayor said in his letter, there's a unilateral removal of various services. It's the same thing. When did you first learn about those removal of services?
I wasn't specific to services. It's a general sense that we have lost volume. We would agree with that. I think the question is whether or not you believe all this is a nefarious action on the part of the clinic, or whether there's a reaction to market forces as a part of a big system of which we don't have control, which you alluded to earlier, Betsy, and how we can play the cards to best serve our healthcare needs.
Well, we know from the documents now that the clinic had a written strategic plan to remove patients and services from Lakewood Hospital. That it was in existence, we believe now, prior to 2010, that they may have misrepresented to City Council what they were going to do at Lakewood Hospital, representing that they were going to bring in centers of excellence when there was really maybe no intention to do such thing. Under those circumstances, Mayor, will you take action to correct the fraud that was perpetrated upon members of City Council in the city?
I was a member of City Council when we voted to make those changes. The fact is, the Center of Excellence, parts of it worked. The rest of it, some parts of it, just didn't work. It was a strategy that, in good faith, I think was entered into by the trustees and the clinic to shore up a volume and try and create a magnet of services from other market areas. And in the midst of all that, remember what was happening in 2009, 10, 11, was the Great Recession and its recovery. And along comes the Affordable Care Act and its impact and advancement of other technologies. It just didn't work. And the fact is, we have yet to hear from Senator Skindell what his plan is, other than to sue everybody and force everybody to look backwards here. I want to know how he's going to get 4,000 or 5,000 more patients a year at Lakewood Hospital. I want to know how he's going to staff physicians. I want to know how that hospital is going to be able to compete against UH, the clinic, Metro, and I want to know how our citizens are going to be able to not be left with a white elephant. I have heard no details other than we're looking backwards, we're suing, we're going to put referendums on the table. I want to hear about health care and how we're going to solve health care delivery.
Your future of Lakewood, with the loss of 1,400 jobs, just paychecks out of the Cleveland Clinic, is a future that is dark for many citizens in Lakewood. Your future of other contracted businesses losing work at the Cleveland Clinic, Lakewood Hospital, is a dark future for those. The future for PJ Butcher Block and TJ Butcher Block and others, small restaurants around Lakewood, is dark with the closure and loss of all those jobs at Lakewood Hospital. My plan is clear. You know my plan. You've seen it. It was on the observation deck.
I don't know your plan.